make the case for you that Medicaid expansion is a Virginia issue in red districts and blue districts around the state. We want to talk a little bit about some polling data that shows that that's the case. We want to talk about the jobs impact in districts around the state from foregoing Medicaid funds. And we want to talk about the potential education money that could be spent around Virginia if we were to pull down our Medicaid money and expand care. It would also give us the opportunity to support our very cash-strapped school systems in Virginia. And we'll share some data with you about that as well. Delegate Serval has put together a PowerPoint presentation. He's going to walk you through that. It's got lots of charts and graphs, so hopefully it'll flow well. And afterwards, a few of the other senators and delegates up here are going to say some words, and then we'll take questions. So hand it off to Delegate Serval.
Great, thanks, Rob. Thank you all for coming today to talk about this, getting health care coverage for everybody in Virginia. As Rob said, I've got about maybe a 10 to 12 point series of slides here. You should all have copies of them. If you don't, we have a copy we can give to you along with all the backup information that was used to generate it. First of all, we're going to talk about really quick is I'm going to explain to everybody how we created our estimates, how we estimated the job creation by delegate seat that Medicaid expansion or the healthcare expansion would create, how we also took Medicaid savings and applied those, created an estimate to show how Medicaid savings to the general fund could be reapplied to secondary education, how much money that would mean in terms of specific jurisdictions. Then I'm going to go over the polling data and go over our bottom line. First of all, here's some assumptions that we used, which were the common assumptions that I think everybody's using in this discussion. First of all, you'll see that the numbers everybody's talking about in terms of how much federal money would come to Virginia is about $1.8 billion a year. That's the same thing as $5 million a day. You take $5 million times 365, you get $1.25 billion per year. The second number, the $285 million in savings, that's DMAS, Department of Medical Assistance's latest estimate as to how much general fund savings we would see in FY15 and FY16 if we were to expand coverage in Virginia. A lot of that comes from indigent care at hospitals. Some of it comes from savings at CSBs. Some of it comes from reduced costs of prison health care services. And then there's about 20 different elements of that, which if anybody really wants to get into it, we can. But that's the estimate, current estimate from DMAS as to how much general fund money would be freed up every single year. Or, I'm sorry, would be freed up in the next 2 years if we were to expand health care coverage for all Virginians effective October 1st of 2014. Not July 1, but October 1. And then the last piece of data that was built into this is that every year, every senator and every delegate gets a sheet from DMAS, which is entitled Medicaid at a Glance. And that document tells us the impact of the existing Medicaid system on the people we represent. It is not by jurisdiction. The data is sorted by delegate and by senator. And it breaks down the Medicaid population within our seats by children, by elderly, by disabled, by blind, and by pregnant mothers. It also tells us the top 5 recipients of Medicaid spending in our district, which are only hospitals, and it also tells us the top 5 nursing facilities in our districts, typically retirement homes, which care for the elderly, that receive money for people that we represent. And then it also has a bunch of other stats. If anybody would like to see the Medicaid glance sheets for the entire state, I'd be happy to provide them. I can email them to you at request. I didn't attach them to this package you got because it would be another 100 pages. But I can provide that if you'd like to see it. But that was where these assumptions came from. What we did was we took for the Medicaid, for the new money, the new Medicaid money, what we did was we took the existing populations by delegate seat of children that are currently receiving health care from Medicaid. And the reason we picked children and not elderly, not blind, not disabled, not pregnant mothers is number one, is that if a child is uninsured, their parent is uninsured in all likelihood. Additionally, the fact that there's a lot of children that are uninsured in that district is also a proxy, not only a proxy for uninsured parents without health insurance, but it's also a proxy for the broader uninsured working adult in the state. And so if you look at the population of the children, that tells you that there's a district, a delegate seat has a large population of uninsured kids getting health care through Medicaid. It tells you that district has a high number of people that are not insured. Okay? So then we took those numbers and we figured out the proportion. The proportion of that delegate seat to the population of the entire state, and then we multiplied it against the Medicaid spending, the $1.8 billion and the 30,000 jobs that the Senate Finance Committee predicts that the Medicaid expansion or the health coverage expansion will create. So, for example, if a delegate seat has 1.6% of the kids in the state that get their health care from Medicaid, we multiply that against 1.8 billion, and we multiply that against 30,000 jobs to show that in that delegate seat that would result in X million dollars and X jobs. Okay. And then we took the education fund, on the education side, we took that number I showed you a minute ago, $280 million, which was the general fund savings. We applied that proportionally by jurisdiction. All 130 jurisdictions in the state to show that if you took the general fund savings and you applied that in proportion to the current direct aid for education, by proportion, this is how much more education money could go to different localities. So you could take that savings, if you put it purely into education, that's where it would go. That was the methodology. So if you take that methodology and you look solely at the top 20 Republican seats that have the top 20 populations of children who receive their health care from Medicaid. In the top seat, that $1.8 billion turns into $29.9 million per year in the 14th delegate seat, which has the largest number of children represented by Republicans in the state. In the number 20 seat, just to give you an idea of the range, it's $19.7 million. That would be Tony Will's seat in Harrisonburg. In terms of jobs, the average is 389 jobs, and it ranges from 492 to 324. New jobs per delegate. It's a lot of jobs. If you take the education money, it would be another 27 point. If you take the general fund money and you reapply it proportionally throughout the state, it would be another 27.6 million for Fairfax, 21 for Prince William, 15 for Virginia Beach, on down. $1.8 million is a lot of money in Danville. It's 1.7 is a lot of money in Franklin County. And if you want to see where these numbers, there's some spreadsheets that are at the end that I attached. I'm not going to go through them, but if you want to see the calculations that are on the back of the package here, okay? The point is that people are voting against a lot of money and a lot of jobs for their people in their districts, okay? Now, the Richmond Times-Dispatch 2 days ago had a column written by Professor Farnsworth from Mary Washington, which looked at the current Medicaid populations, and it highlighted by map the 50 districts with the highest percentage of Medicaid recipients and the 50 with the lowest. Darker colors are the highest, and the lighter colors are the lowest. And as you can see, many of the districts that currently have huge Medicaid populations are represented by Republicans, which is a very striking, I thought it was a very striking graphic. Now, yesterday, we may have gotten word from the Virginia that there was some polling done. And that was done by the Virginia Civic Open Table, which is a coalition of 17 organizations across Virginia, to whom health care is very important. And they did some polling in 5 seats. 5 seats where they felt their constituencies where Medicaid expansion or health care expansion was important to their constituencies, and where there were people representing those districts who had expressed opposition but had an opportunity to make an impact. Appropriators, people on the Appropriations Committee, or people with high populations. And these are the seats they pulled. You can see they're all over Virginia. We have the 9th, which is Franklin County, and I think it's Pennsylvania. Then we have the 14th, which is Danville. The 97th, which is Hanover. The 97th, which is Portsmouth. Actually, that shouldn't be 97. That's the 79th, which is Portsmouth. And the 31st, which is Prince William and Fauquier. And what they found in their polling was this. First of all, this is Governor McAuliffe's approval rating in the poll. These were polls taken of, I think, about 700 registered voters who had participated, random voters who participated in one of the last 3 federal elections. It was done by Public Policy Polling. It does a lot of polls that many of you in the media use them for your polling. Found that this is Terry McAuliffe's approval rating in those districts, which is not stellar. He's at 54% in Johnny Giuano's seat, but he's below 40% in these others. GOP ID is how many people identify themselves as being Republicans. And then this is how many people say they should expand Medicaid. This was the question. Virginia is eligible to receive $5 million in federal funding each day to pay for health care for working Virginians through the Medicaid program. Do you think Virginia state government should accept this federal funding to expand Medicaid coverage or not? Every single seat, the majority of respondents said they support the expansion of Medicaid. Even though if they think Terry McAuliffe is under 40% approval, even if they're big Republican populations, these people think that we ought to expand Medicaid. We have here the number of people who responded that do not have insurance by seat, and we have the numbers that the Department of Medical Assistance said in terms of what the existing Medicaid population is in those seats. And the full poll with the crosstabs is at the back of this for each one of these. So if you want to see what the poll says, you want to see what the crosstabs say, you want to see how many Republicans support this or Democrats support that, you want to see the other questions that were asked. There were 9 questions asked, I think. It's all right there. But the bottom line is that whether you're a Democrat, whether you're a Republican, whether you think the governor's doing a good job, bad job, whether you're urban, whether you're suburban, whether you're in Hampton Roads, Richmond, Northern Virginia, there are clear majorities in Virginia that support the expansion of Medicaid and that support the expansion of health care coverage. And what are they turning down? Again, look at these numbers. These are the seats I just pointed out. The support in those seats, the support shown for this in the poll. And then the analysis that I described to you earlier about the money by delegate seat and the jobs. You have people that are turning down, between $12 and $25 million of Medicaid spending in their seat, the people they represent, and turning down between 190 and 492 jobs. These are rough estimates, okay? Our assumptions are not perfect. There's not an easy way to do this by delegate seat because the U.S. Census doesn't provide data. The number of children is the best proxy to use. But these are the best estimates we were able to come up with. And then if you look at the education dollars, what we did was we took the jurisdictions those people represent and added that up. So just so you understand, this $12 million is all of Prince William and all of Fauquier. Scott Lingenfelter doesn't represent all that, but that's the only way to do it on the education funding side because they don't break down education funding by delegate. They only break it down by jurisdiction, by locality. So, but these are the kinds of numbers that you can see being invested into education if we freed up that general fund money and put it all into secondary education. It's just an example. It could be put in other places as well. But it's a lot of money, it's a lot of jobs, and people support it. And the last thing, what are the bottom lines here? Is that most residents who live in seats where people are currently opposed, where legislators are currently opposed to the expansion, most residents support the expansion. Number one, many districts that would most benefit from this are represented by opponents of the expansion. If you look overall, my Republican colleagues are turning down $1.9 billion of money for their seats. $1.9 billion of the $1.8 billion would probably go to Republican seats based on the estimates that we did. They're attached right here. 1.19 billion.
Just making sure that's
17,880 of the 30,000 jobs would be created in Republican areas of the state. And we're turning down millions of potential new education spending. And at the end of the day, what we're really doing here is talking about balancing the budget. People talk about the budget being balanced. The reality is the budget is being balanced on the backs of law enforcement, our safety net, and our schools by turning this money down. That's the reality of what we're doing. And people don't support it. And so you're going to hear a lot of talk and a lot of hot air down here from a lot of the opponents. But Virginians do not support their strategy. That's the point. And having said that, I'd like to turn it over now back to Rob, I guess, who's going to turn it over to Adam. Okay, Senator Evans is going to say a few words. Oh, I'm sorry. One more thing I want to say before I forget. One thing I want to say is that we've started a petition. It's at www.coverallva.com for people to sign to express their support for closing the gap and people to sign their support for the expansion. We want people to contact their legislators, and there's a rally on Saturday here at the state capitol. It was next Saturday.
a week from Saturday.
A week from Saturday, okay. A week from Saturday. People need to attend so they can be heard. But these are the things we're going to be asking people to do over the next week. Having said that, I'll turn it over to Senator Evans.
Thank you. Delegate Serville has made the case for why this should be done financially and what this means in various delegate districts. But I would encourage members of the media, I don't usually tell you all how to do your job, but there are real people suffering because of this, real people who would be helped. And I would encourage you to talk to the real people in your markets. Now, of the 400,000 Virginians, they're not just a number. They're real people who we see every day. They're working families. They come from many different fields and backgrounds, including 12,300 veterans who serve this country. And I'm just going to tell you about one real person in my area that Innova's Mount Vernon Hospital told me about. A working taxi driver who suffered a stroke in his 40s and was unable to afford insurance. You know, they were able to provide it for his acute needs and rehab, but due to a lack of coverage, he didn't get all of the post-stroke care that he needed. And it took him longer to recover, and he may never reach the capacity that he had without adequate coverage. These results make real people suffer. It makes our economy suffer. They're going to the emergency room. They're going to get care like this gentleman did at Innova in most cases. But at what cost? We're paying for it with increased insurance premiums in the private sector. So we need expanded health coverage. And I would point out that in the Senate, there's bipartisan support for expanded health care coverage. You hear from these delegates how there's support from Democrats in the House of Delegates. The only party who's not at the table is the House Republicans. They're the ones who need to come to the table. We've seen that Virginians support this. We've seen that elected leaders from the Democratic Party support this. Senators of both parties. The Senate plan was devised by a Senate Republican. It's time for the House Republicans to wake up and answer to the people of Virginia. If not, they're going to be held accountable. Thank you.
Good morning, everyone. My name is Charnel Herring, and I first like to thank Delegate Krupika and Delegate Serval for the outstanding presentation. A few weeks ago, one of my colleagues, actually it was last week, said that that my side of the aisle typically tells heart-wrenching stories and likes to remove themselves. They seem to want to remove themselves from the reality. And we typically, as legislators, unfortunately, don't want to realize what it's like to be in someone's shoes. We as legislators are part-time, and we have great health insurance. It is hard to go to work, to feed your family, and you're scared. You're scared about some disease that you may have, and you cannot get the proper treatment. It's time that they start to put themselves in other people's shoes. You saw the presentation about, in the graphic, the slide that talked about the people in their districts who want the extension of Medicaid. These are the very people that wake up probably every morning scared to death. Maybe they find their sheep soiled and don't know what it is. They cannot get the proper care. This is our opportunity. This is Virginia's money. It's our taxpayer money. And it is immoral for us to let it go outside of the state the way that we're doing. It's time for the House Republicans to step up. It's time for them to put partisanship aside. The Republicans have done it in the Senate. It's time for them to grow up and come to the table and have a true discussion about the expansion of Medicaid, closing that coverage gap so that Virginians can live a healthier life. Thank you.
Good morning. I'm Delegate Kay Corey from the 38th District, and the first thing I want to do is to thank these gentlemen for putting this presentation together. It really presents the stark reality to us. Not only are we refusing to invest in health care now, we're refusing to invest in Virginia's future. We're saying no to the future by not funding K-12 the way we should, by not funding early education the way we should, by having huge classrooms, underpaid teachers. We are not providing the future that we have the responsibility to provide for this state. It's not only immoral, unhealthy, and a very, very bad economic decision. So again, as Delegate Herring said, it's time for the majority party in the House to wake up and come to the table.
That's a good.
All right. I think that's it with our formal presentation, but we are happy to take questions, and I'm guessing I'll be passing most of them to Scott, but the delegate sort of already standing. Any questions?